Double eyelid surgery revision. I had my first double eyelid surgery done 27 years ago. It resulted in both eyes being uneven. As time went by, both eyelids have dropped. However, the right crease was still too high and the left crease was too low and becoming a triangle eye. I had my second revision 3 weeks ago. I regretted it because the left eye looks significantly older now with multiple creases. The right eyelid looks even deeper and thicker. How to remove multiple creases? Should I consider a third revision?
Thank you for your question. You've submitted some photos and a history where you state that you had Asian eyelid surgery 27 years prior and that you were concerned about the unevenness and that now you've had a second revision operation 3 weeks ago and you're concerned about the depth of a crease as well as multiple creases on one side. So before you feel like everything has become a problem or something went wrong, let's learn a little bit about the nature of Asian eyelid surgery and also learn a little bit about what happens with facial aging, specifically for Asians in the eye area. So when you had your original Asian eyelid surgery, you probably had a lot more fat and thicker skin when you were younger. And so it was done in a certain way. And typically that would involve removal of a little bit of skin, removal of a little bit of fat, and the anchoring of the skin to the levator muscle, the muscle that lifts the eye that's responsible for the crease. Now, one thing that happens as a lot of people of Asian descent get older is they lose volume of fat in the orbital space. So what was once an area of fullness becomes relatively hollow. And in our practice, we've had many patients come to us who had this situation occur, and paradoxically, what we do for them is we'll actually place a filler to add volume to create that fullness right below the eyebrow in order to create that shape. So that's something to be mindful of as to what has gone on in terms of the anatomy over this time frame. As far as the concern about the appearance at this point, understand that at 3 weeks there are a lot of dynamic changes occurring, and it is not uncommon for people who have Asian eyelid surgery to be concerned about swelling, irregularities, and asymmetry at this stage. If your surgeon is an experienced cosmetic surgeon focusing on eyelid surgery for Asians, then typically they'll have more than enough experience to know what to anticipate and to help you get through this transition phase. You can't necessarily draw long-standing conclusions about what is going to happen 3 months from now, 6 months from now, from something that's 3 weeks from the time of surgery. In my practice, I tell patients that it takes typically 6 months to a year for full healing, and therefore you don't want to go in and do something prematurely thinking that there's something different than what you saw during surgery. When I perform eyelid surgery, whether it's ptosis surgery or in some cases of Asian eyelid surgery, I'll actually have the patient open and close their eyes to see how they look. And of course, if it's Asian ptosis surgery, we definitely do that. And we get a good sense of whether or not the shape of the eye is responding to what we are trying to achieve. And so with that being said, I think it's important that you communicate with your doctor, the doctor you trusted to perform the surgery, and get a sense of what's going on, why there is this difference between the two eyes, and I think it's reasonable to at least observe for the next couple of months to see how things settle out. Sometimes a little enhancement is necessary, but in the short term, in 3 weeks after surgery, you don't want to draw conclusions which are ultimately will probably resolve themselves on their own. Again, this is information that you should probably best get from your doctor, but I can tell you, as a specialist in eyelid surgery, focusing a lot of my practice on Asian eyelid surgery, that it's not unusual to see a scenario like this on a second or third surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.